Occupational medicine!
This video is about the occupational medicine case write-up and provides a framework for diagnosing occupational diseases. We'll explore the steps for diagnosing occupational diseases and the importance of specific assessments. A complete medical history is vital, covering current and past complaints, family and personal history, including lifestyle factors like smoking, hobbies, diet, and living environment. The occupational history must detail job descriptions, nature of present and previous jobs, duration, exposure history, and all routes of exposure, like inhalation, skin contact, and ingestion. It also includes past occupational illnesses and exposure records. Clinical examination consists of a general physical examination and a specific examination of possible target organs related to occupational exposure. Relevant investigations involve general laboratory tests, such as blood and urine exams, and specific or confirmatory tests like chest x-rays, spirometry, audiometry, and skin patch tests. Reviewing medical records, pre-employment, and periodic examinations is essential. Changes in lung function or baseline audiograms can help monitor sensitivity or shifts in hearing threshold levels. Further record review includes specialist reports, occupational medical surveillance, medical certificates, incident reporting, Social Security and insurance claims, and exposure records. Other critical records include material safety data sheets, chemical health risk assessment reports, workplace exposure monitoring, and ergonomic surveys. Next, we will discuss the work and workplace evaluation, which is key to understanding the context of potential occupational diseases. Workplace evaluation identifies hazards and existing control measures through walkthrough surveys. This determines the type of hazard and the degree of exposure. Workplace hazards include physical, chemical, biological, ergonomic, and psychosocial factors. Health effects depend on the concentration, duration, frequency, and latency period of the hazard. Control measures include elimination, substitution, and engineering controls like total enclosure, local exhaust ventilation, and isolation. Administrative controls cover policies, training, medical surveillance, and warning signs. Personal protective equipment programs ensure PPE is suitable, fitted, and readily available with proper procedures. In summary, a comprehensive assessment of the worker, work, and environment is essential for diagnosing an occupational disease. There must be a strong correlation between workplace hazards and the disease. The next step is the diagnosis, which involves
occupational medicine practices.
Key aspects of good occupational medical practice include the duties of a doctor registered with the General Medical Council, emphasizing good clinical care and maintaining good medical practice. Other principles involve teaching, training, and assessing. The case write-up structure includes an introduction, competent, keep their knowledge and skills up to date, establish good relationships with patients and colleagues, are honest, trustworthy, and act with integrity. The duties of an occupational physician involve visiting the workplace to advise on safe and healthy conditions and promoting compliance with health and safety legislation. They also help develop policies to promote. Additional duties include assessing fitness for specific tasks, recommending suitable adjustments, and monitoring the health of workers exposed to hazards through health surveillance programs. Occupational physicians analyze surveillance data, advise employees and employers on work-related health issues, and assess potential cases of occupational injuries and illnesses. Their responsibilities also cover managing immunization programs, case managing sick workers for the earliest return to work, and recommending suitable alternate work when needed. Furthermore, they determine eligibility for ill health retirement and ensure people have the necessary health information to perform their work safely and improve their own health. This chart illustrates the comprehensive functions of occupational health services, highlighting their broad scope of activities.
We hope you love the fun features. UPM.
That is nice.